THINK stands for TB and HIV Investigative Network. THINK was started with an urgency to make a difference. We had such a unique combination of skills, and being in South Africa where the TB and HIV burden is just so great. And in this mixture we have the expertise in our hands as cutting-edge researchers and public health experts. So that's how we started, in a room of DMC. You know all about that one.
Yeah. In a small room at Durban Medical Center where we started our first clinical trial with Otsuka. I think there was about 3 of us, and then and we expanded to 5, and then after a couple of years, I think it was about after a year, actually, it grew and it became a fully fledged organization.
So we do the whole scope from prevention to care to treatment and follow-up. Majority of our funding is international, and it is linking international expectations, if you would say, with our capacity and abilities here. So if you put it critically, on the research side, we sell data. So now we've also branched out from the research component into health systems strengthening and health service delivery.
In KwaZulu-Natal, we got about 1.2 million patients who are on ARVs, and the national target is to get 2 million more patients on ARVs by 2020. The global goal is 2030. To making sure that we end AIDS, and we are part of that. We are in the forefront of that within the clinics. With the Global Fund project, we're working with 72 clinics in eThekwini, making sure that every clinic is sustainably providing a proper adherence support for patients.
I think we have a very unique leadership in that we don't lead from the front.
Yeah.
We're at the back. We're providing the foundation, we're providing the skills development, the capacity development. And obviously if you're the foundation, you have to filter through right till the end product.
Being in the leadership, being in the person who's at the bottom, being in the people in the middle, or the whole team just makes it this one big, huge family.
We're all reaching towards that same goal, and that's, impacting one patient, one family, one community, and eventually the whole world. Yeah.
If there is a task that needs to happen, no matter how low it is, you'll find Christina, who's the head of the organization, doing that task.
So I like to step into the clinic sites and the field sites, because only then can I understand. It's empowering for me to know what the work is like, and I will be much better in my decision, much more informed when I know what is going on the ground, rather than just sitting in a fancy ivory tower and guessing.
I think that's one thing that connects
the
dots, and to be able to provide the quality of work that we do. The most important person at every site in the organization, for me, is the cleaner and the driver. Yeah. If the driver does not take patients to where it's supposed to, it means the pharmacist cannot dispense. It means the doctor cannot do anything. If the cleaner does not clean our offices, our image is damaged.
THINK believes in people. We've demonstrated that internally. We don't just leave those values out to be the values which are on the wall and to be values which are written down, but that value is within us, and we can execute that value. From recruitment, from engaging the hospital management, from engaging our clients, and I think it's how we've actually been able to demonstrate excellence in what we're doing.
The main thing that keeps me driven is the passion.
Yeah.
You can't explain it, but it oozes out of everybody. And that makes it exciting to get up and face the challenges. When they come, you know what you stand for, and you've got all these people behind you.
We're all about making a difference, and we're making a difference by being a research organization and improving healthcare systems. And so it's all about, theoretically, it's all about the difference that we're making out there. But at the heart of it, at the core of it, in the office, at the clinic, it is about the difference that we're making in each other's lives as colleagues. And that is where it all starts.
In South Africa, there's about 7.8 million people living with HIV, and the government mandate is to get everybody, at least 90% of those on ARVs. And our mandate is to look at what can we do to make sure that those who are already on medication, they stay on medication.
Yes.
At the center of everything that we do, I think, the most important person at the center is the patient.
Yes.
Be the trial participant or be it a patient in a community. Because that data you look at, there's a face behind that number. And I think what keeps them coming back is how we are able to demonstrate transparency and going an extra mile.
Why I personally feel sponsors come back is because what we have, I think, is we allow sponsors to step into our world. They would never meet that patient.
Yeah.
But they can understand a lot more than the data they receive, the black and white paper.
Yeah.
And we are that middle person that marries the two.
And we have the trust of them thanks to our transparency, our competence, compliance with international norms, local rules and regulations.
So those kind of things that adds everything together, comes up to it adds up to our brand, to our image.
Some of the successes that we must remind ourselves to celebrate is also that in the context of TB and HIV, we have already brought down treatment to 9 months instead of 2 years, so 9 months for MDR TB treatment, to the point where it is now standard of care and recommended guidelines by the WHO.
Every time when I hear a government person standing up and saying, treatment is no longer for 18 months or for no longer for 2 years, it is now for 9 months, I always say, we contributed to that. Yes. We are the one that brought in the forefront data to say it is possible.
Yeah.
We do stigma workshops with the clinics because sometimes people say, I don't want to take my medication because there's stigma. I didn't go back to the clinic because I was stigmatized as an HIV positive patient. Overcoming those barriers is really what we do in the support clubs. And you call them into a very comfortable space where they get to speak about it, provide treatment, overcome barriers. That's the success that we've done.
I think we're working on our 7th year.
Yeah.
And you'll find out that when I joined, or now at the moment, when you look at the growth from year 0 to now, our growth is we have grown more than 100%.
In KwaZulu-Natal, we are known within the Department of Health that there is Think. We are known in national level. So we've become a demonstration for others to say, how have you done it so well, so that we can attract more people to do it well as you have done.
So another important thing is to remember that for TB, we haven't had any new drugs for TB since the 1950s. We have seen the development of the first 3 new drugs since the 1950s.
Yes.
And we have been using all of these 3 new drugs and are contributing to bringing them forward to the market. And this is not just in adults, but also in children. We're all about working smart, not hard. And to help us do that is that we have to live in a world that is evolving. And the tool is business intelligence. We make evidence-based decisions based on our own data that we have collected and we are forming ourselves, and this is then the platform to support all of this is then business intelligence. The WHO recommends directly observed treatment, which is what DOT means, which effectively means that a patient should see a clinical staff every single day to observe that the medication has been taken. So by introducing video DOT, which means that you can have a cell phone and you can video yourself when you take your medication, then that video will be automatically uploaded and then downloaded into the clinic, where somebody can watch these videos and take note of if you have taken your medication. If the clinic does not receive a video, they can immediately reach out to that person and say, hey, what's going on? How can we help you? But for patients that are obviously sending the videos all the time regularly, they don't need further assistance. So the limited resources that we have, we can then deploy them more effectively to where they're actually needed.
We have 2 words actually, that is trust and integrity. Because the integrity part comes when the work we do is thing. We install some trust in what we do. It's that trust that builds the team, that trust that we give to the patients, to the funders to trust us and give us that work that we are doing to make the difference in the world.
The best word, and it falls short, is passion.
Yes.
And we are all just passionate people, and we somehow are able to transfer that to whoever we come across.
Yeah.
And we're working with infectious diseases, but the one thing we infect people around us with is passion.
For me, if I'll ever describe think in one word, I'll say it's a resilience, the ability to bounce back. I think over the years when we've started, we've been through so much, but we keep on coming back. And we've come back big this time.
The one word to describe think is authenticity. And that is because each and every one of us that works within think is we look for people with shared values. And that authenticity is what gives birth to all these other things, the transparency, the integrity, the passion, because it's all authentic.